Hi, I'm Mohit Mathur, Senior Vice President of Medical Affairs at Diagnostics. And today I'm going to walk you through a study that uses real-world evidence to compare guidance UTI, which is an advanced diagnostic for complicated urinary tract infections, to the standard of care, which is standard urine culture. This evidence was presented at the 2022 AUA annual event, and it basically compares medical resource utilization, cost, and adverse outcomes between guidance UTI and standard urine culture. The cohort selected was complicated UTIs, which is the target patient population for guidance UTI. The risk factors that were included here are those such as being male, diabetic, immunocompromised, and the other factors listed on the slide, because these are the cases that lead to high cost and adverse outcome for UTIs, which can be significant, reaching into the billions of dollars every year for the US medical system. Complicated UTIs often have a poor clinical outcome, and because the treatment is based on standard urine culture, which does have a lot of drawbacks, that may predispose these patients to suboptimal outcomes. So some of the shortcomings of standard urine culture include its slower turnaround time, its low sensitivity. So in many cases where there's a patient with multiple signs and symptoms of a UTI, you may get back a negative result from standard urine culture, which leaves you in a difficult position when you're looking to treat that patient. Also, standard urine culture has a difficult time doing polymicrobial infections, which we now know are a significant fraction of UTIs. So understanding the dysbiosis that's occurring with a polymicrobial infection is important, and there are severe limitations with standard urine culture when attempting to do that. Guidance UTI is a technology that incorporates a couple factors. One is there's a PCR identification of the organisms present in the urine, which, as we know, is a very specific and sensitive technology, and also one that has a very quick turnaround time. So using PCR, you get polymicrobial infections identified, you get semi-quantitative values, and you get a quick turnaround time that comes with the PCR. Resistance genes are also identified using PCR technology. So there's a result that tells you what the genetic information is on resistance, which is important. However, what's unique to guidance UTI is the pooled antibiotic susceptibility test, which gives you a phenotypic result looking at the pool of organisms present and what antibiotic is efficacious against that pool of organisms. This is unique to pathognostics. And it's really critical to have that when you're using a molecular technology, because one, you want to ensure that there are living cells that you can grow out in that infection, and what you're testing the antibiotic against are those living cells, so it's not just dead DNA. And also you want to ensure, because of changes in expression patterns, because of changes in resistance when you have polymicrobial infections present, that you're testing the antibiotic against that pool of organisms, which is what PAST does. Combining all of those things, the resistance gene information, the organism identification, and PAST, that entire technology is guidance UTI, which is reported back in a very easy to understand single-page report that gives you a lot of information to make the best treatment decision for your patient in a very rapid period of time with a less than 1 day turnaround time from receipt in the lab. The study basically started with a 5% Medicare database from 2017 to 2019, which had 3.5 million beneficiaries included. It was then filtered down using the various components of what the study outcome was supposed to be. Complicated UTIs were the first filter with a 12-month baseline, leading to an index complicated UTI event. After that, there was a matching that occurred to match culture results to guidance UTI at a 10-to-1 ratio, ending up with 678 standard urine culture cases and 69 guidance UTI cases, where you could track the UTI-related clinical healthcare use and cost outcomes throughout 1 year. So the purpose of the study was, one, to have a baseline for 12 months, find the complicated UTI events, and then follow the index event for a year to look at what happened to that patient over that period of time. It was really important to propensity match the guidance UTI cohort to the standard urine culture cohort. And the reason that's very important is when you're not doing an RCT, you want to make sure that you control for confounding factors to the extent that you can. And that's what propensity testing does. So important factors such as diabetes, gender, and other factors listed here were matched as closely as possible between guidance UTI and standard urine culture. So when you're looking at the eventual outcomes, you're looking at what the impact of was used because you were utilizing one technology versus another, and not because of biases that are introduced because there's a mismatch in the number of some of these confounding factors in one group versus another. So you can see here that many factors were taken into account, and they were shown to be matched well between the two cohorts. The first thing the study looked at was the reduction in additional UTIs that may occur with use of guidance UTI, and there was a 0.4 reduction in additional UTIs when using this technology versus using standard urine culture. As importantly, or more importantly, when there was an additional UTI, it was significantly cheaper for the healthcare system when guidance UTI was utilized. So the average cost per additional UTI when using guidance UTI was $274.10 versus $420.33 with standard urine culture. Overall, the average cost for a patient when using guidance UTI was $767.48 versus $1,303.20 for standard urine culture. So both by reducing the number of additional UTIs and by reducing the cost associated with an additional UTI, there's a significant reduction to the impact on the healthcare system. The reason for the reduction in cost is because there are fewer hospitalization or SNF admissions with guidance UTI versus standard urine culture. What that gets to is that's a significantly improved patient outcome, because those are the things you want to avoid for a patient. You want them to remain in the outpatient setting. You do not want them to end up in the hospital, because that means that they got significantly worse. And then, of course, there's all the healthcare utilization costs that come with that outcome. Looking at overall costs between guidance UTI and standard urine culture, when you look at total costs, including outpatient and composite inpatient admissions, there was a 44% reduction using guidance UTI versus standard urine culture. When you break that out to what we call composite costs, meaning just urgent care, emergency, hospital inpatient, and UTI-related SNF admissions, there was a 77% reduction when using guidance UTI versus standard urine culture. So on an average, a cost of $141.60 versus $605.06, just looking at those four significant claims data related outcomes. When you look at the outpatient cost, there's only a 7% reduction with the guidance UTI and standard urine culture, which is expected because that's where you want that patient to stay. So they come in, they get diagnosed, they get treated. There's that cost associated with, they end up far fewer in these advanced care settings. There were no urosepsis cases with guidance UTI in this cohort versus with standard urine culture, obviously leading to a significant reduction in cost there as well. So when you look at guidance UTI overall cost, where's the cost coming from for guidance UTI for these complicated UTI cases? 78% of the cost is from outpatient. Only 22% of the cost is coming from these advanced care setting admissions. Whereas with standard urine culture, it's split about half and half between composite and outpatient, which is not unexpected because even if it's a far fewer people that are getting admitted to the hospital or urgent care, there's a very high cost associated with that. And that's really what's driving a lot of the healthcare costs that we know are associated with UTIs, is when these patients do not get treated as well as they could be, get worse, and end up in the hospital or urgent care or SNF. Overall, what this shows is that we, one, have shown a significant reduction in costs associated with complicated UTIs when using guidance UTI versus standard urine culture, and a reduction in adverse outcomes. The recurrent UTIs were fewer with guidance UTI and significantly lower costs associated with them. And these results are very consistent with previously published studies. So there is that study that showed a 14% reduction in emergency room in hospitals, and also significant saving because of that. This reinforces that using real world evidence and actual claims data using guidance UTI and standard urine culture to show that reduction in adverse outcome and cost saving. So overall, what we're demonstrating here is when guided UTI is utilized in complicated UTI cases, it can reduce cost, reduce adverse outcomes, and maybe the most appropriate technology to use for those cases which have these kinds of complications associated with them.